Hello and welcome. Welcome to the American Psychological Association series on careers in applied psychology. I'm Beth Schwartz from APA's Office of Applied Psychology. And through our career videos, we illustrate the different types of careers that apply psychological research, theory, and methods to address important real-world issues. Today, we have a great panel of experts focused on public service and psychology. And to introduce our panelists today, I'm pleased to introduce Dr. Ashley Battistini. Dr. Battistini is the 2022-2023 president of our Division 18 for Psychologists in Public Service. She's faculty at the University of Memphis in the Department of Counseling, Educational Psychology, and Research, where she teaches, supervises students in clinical work, and conducts research related to forensic and correctional psychology. Dr. Battistini will be introducing our esteemed panelists today and leading us through a series of questions to help present career paths and career options to psychology and public health. Dr. Battistini, the floor is yours.
Thank you. And thank you all for tuning in to learn more about applied psychology work in public service sectors. My job is to help you better understand what we mean by public service and how psychologists fit in these settings. Public service essentially means work that serves the public interest and is typically publicly funded. Psychologists who work in public service represent an incredibly diverse group of practitioners, researchers, educators, administrators, and consultants, among other roles. We can be found working for or with clients in state and community psychiatric facilities and clinics, medical centers, Veterans Affairs hospitals, correctional institutions such as jails and prisons, Indigenous nations, and community safety departments such as law enforcement and first responder emergency services. In fact, public service settings are some of the largest employers of licensed psychologists and other mental health professionals. We also have a rich history of placing social justice issues and advocacy at the forefront of our work. Working in public service settings can be stressful sometimes because you're often required to navigate and challenge systemic barriers. However, as a public service psychologist and knowing many public service psychologists, we find our work highly rewarding and view it as a way to live out core values of our lives. Most public service settings also qualify for federal public service loan forgiveness program. If you are interested in learning more about that program, a quick internet search will tell you more about it and how you can benefit. I'm excited to introduce our four panelists who will give you a glimpse into the applied opportunities available in public service psychology. So let's get started. Dr. Edgar Villarreal began his career at in the VA at the Central Texas Veteran Healthcare System, where he served as the program manager for outpatient mental health. He is now the National Clinical Director for Suicide Prevention for VA's Office of Mental Health and Suicide Prevention. Dr. Jessica Pollard is the Senior Behavioral Health Advisor for the National Association of State Mental Health Program Directors and previously served as Director for Maine State Mental Health Authority, the Office of Behavioral Health. Dr. Tammy Lin served in a variety of clinical and executive leadership roles in corrections, including oversight of all psychology programs in the Federal Bureau of Prisons between 2015 and 2020. She became one of the few women wardens in this position. Dr. Lin's current work is as an executive coach and consulting psychologist focusing on high impact, high stakes leadership roles. And finally, we have Dr. Abigail Tucker, who is a licensed psychologist in Denver, Colorado. She was a former program director of a jail-based mental health unit for over 10 years and is one of 3 co-founders of Heroes Active Bystandership Training, LLC. Heroes trains correctional officers, healthcare workers, and emergency responders to build a culture of accountability and wellness. Welcome to all of you. I'm very excited to hear what you have to say today. So we have 4 questions for our panelists, and each panelist will provide an answer to the same question before we move on to the next question. So I'll start with you, Dr. Villarreal. Our first question is, how would you describe your job to a total stranger?
Thanks, Ashley. Can you hear me okay? Just make sure that I'm coming clear. Great. Well, that's an interesting question. I think all of us in public service wear many hats, so I'm going to try to do my best to be concise. So, I think the best way to describe my role is that I develop and implement policies, programs, and interventions that help drive suicide prevention strategies across the VA healthcare system, which is the largest integrated healthcare system in the nation. I have the honor of supporting the teams of individuals at our healthcare facilities that, and really across our communities that help prevent veteran suicide across the over 9 million veterans that are enrolled in our healthcare system. And then even those veterans that are choosing to receive their care in the community. I oversee two major programs that I think are worth noting. I oversee the operations and the technical assistance to the over 600 suicide prevention staff that we have located across our healthcare facility. And then I also oversee the operations and the technical assistance for over 100 staff that make up our suicide prevention telehealth program, which provides evidence-based interventions directly to the veteran's home. And in my off time, I have the pleasure of also serving as the chair for the VA section of Division 18 in APA.
Thank you. That's a big role that you have. How about you, Dr. Pollard?
Well, in speaking to total strangers about my job, after we get past the usual psychology jokes, then I would explain to people that the National Association of State Mental Health Program Directors, or NASHPD, we provide support to state and federal leadership who are providing mental health services across the country. So the state public health authorities or mental health authorities that serve people generally with serious mental illness and other mental health conditions. So we provide support, training, technical assistance, policy development, and really at the bottom line, we're making sure that programs and services that we know can help people in recovering from mental health challenges are actually available to people in the community.
Great. Thank you so much. Dr. Lynn.
Hello. When people ask me that question, I often have to decide where to start because I've been able to do a lot of things in my career, but in my current role, I try to bring what we know about psychological science and its relevance to leadership and to organizations. And I bring that information to leaders and teams who want to perform better, but who may not have the insights or the tools that will help them to reach their goals. So that's the role that I perform now, and it comes from a long career in corrections, working in very high intensity, demanding environments, and trying to bring principles like resilience and self-care and interpersonal skills to environments that really needed them. As a clinician in corrections, I did the full range of assessment and treatment for people in custody and also for staff who needed support and who would look to institution psychologists to provide that. So the great thing about a career in public service and in corrections in particular is that we get to contribute a lot of different ways, and then it applies to future career directions. So I'm looking forward to talking about that.
Thank you. That was great information. Dr. Tucker.
Thank you. Well, I think as Dr. Pollard had stated earlier, this question happens a lot. I'm really glad that you asked it. So whether it's at the carpool when I'm picking up my kids, or in work settings, even working in multidisciplinary work settings, or even just my own family, I often describe my job quite simply as I get to help other people and the places that they work and live be healthier. And actually living with that value has helped me because as Dr. Lynn stated, I think a lot of us can relate to having multiple career paths and opportunities, which is one of the things that I like about being a public service psychologist, because I tend to get bored easily. So it's fun to be able to try on different hats. But if I stick to the value that I'm here because I want to help people and the places that they work and live be healthier, sometimes it can make even some of those stressful decisions that you talked about earlier, Dr. Battistini, it can make some of those stressful decisions a lot more simple. So thank you for asking.
Thank you. Thank you so much. All right, so we already know a little bit about what each of you do, but I'm curious if you could give more of a snapshot about your career journey, including, some of the training and education that was needed for you to get to where you are today.
All right, well, I'll start us off, and thanks for taking me through memory lane. I hope I don't don't bore you with my history, but I think for a lot of us, I really kind of started in my undergraduate career trying to figure out what direction I wanted to take, what I wanted to do, and like many people, I chose to major in psychology, just thinking that it was going to be interesting, not really knowing what the potential for the for that major was, and then really kind of starting to think about what can I really use this degree in order to be able to impact people's lives. And it wasn't until my sophomore year in undergrad where we had the unfortunate incidents of having someone in our dormitory attempt suicide. And it really kind of sent a shockwave through a lot of the people in the dorm. I think at that point, still being fairly young, trying to make sense of people in the world, it really kind of put me in a different trajectory, in a different direction. So I started becoming very curious about trauma and suicide, and I ultimately ended up volunteering at Texas A&M University, which is my alma mater, at their crisis hotline, and was trained in it. Actually ended up staying there for 7 years because I ended up staying there for graduate school, and ultimately became one of the graduate supervisors for the hotline there. And truly, early on in my career, one of the best experiences to be able to get hands-on and helping people very early on and looking at the potential for a psychology degree. Once I got into grad school, I fell into the work of helping veterans, like many of us do, and kind of got bit by that bug. I think once you kind of start working with veterans and get a sense of what a unique population it is, what an interesting population it is, what a fantastic healthcare system we have, really kind of fell in love with the work. I went on to complete my internship for psychology at the Denver VA Medical Center. And then after I completed internship, I decided to briefly step outside of the VA, but still in public service. I ended up completing a trauma psychology postdoc at Brooke Army Medical Base with the Department of Defense. And then I decided to jump back into the VA, and I took on my first job as a trauma psychologist at the PTSD clinic at Central Texas VA, and quickly jumped into a supervisor role, started supervising outpatient mental health programs in the healthcare system. And I think that that's ultimately what shifted me into healthcare administration. I've held several healthcare administrative roles in terms of becoming a program manager. I was also the acting deputy chief of staff for mental health, the director of education and training for VA Rocky Mountain Myrick for suicide prevention, which is kind of the VA's center of excellence for suicide prevention. And then now stepping into this role, I have the honor of being the national clinical director for suicide prevention for the VA. So I think, like Dr. Lin mentioned, being in public service just gives you so many options and so many opportunities, and you kind of feel like you're a kid in a candy shop, not knowing whether you want to stay where you're at or if you want to try something new and stretch yourself. So I've been really fortunate to have this career trajectory.
Thank you for that. And really quickly, for anyone listening or watching who may not know what an internship is in psychology, because I imagine some other panelists will mention their internship experience. When you're in a PhD or PsyD program in clinical school or counseling psychology, the final year of that is a full year, kind of like people think about medical residency, where you're really specific in an area, like working in the VA or working in a prison. My internship was at a state hospital doing forensic work, and you're really practicing full time under the supervision of another licensed psychologist. So it's kind of this final step in your education and clinical experience at the doctoral level. So thank you. Dr. Pollard.
Well, I can relate to that, using that phrase, kid in a candy store. There are so many things that you can do that are so interesting and impactful. I was fortunate to have experiences as an undergrad that I actually didn't like. And I had originally started my career thinking I wanted to be in special education. But there were things about that role that just didn't feel like a good fit for me. And it started to get me more interested in the psychology courses I was taking and thinking about clinical psychology and how do you address system challenges. And so I ended up entering graduate school as a clinical psychology grad student, thinking that I wanted to really work more in the therapeutic space. And that I was kind of stunned to learn in grad school how long it takes. The stat I learned at the time was 17 years from the time that research identifies an effective intervention for mental health to the time that intervention is widely available to people. And that's just shocking, or it really was shocking to me at the time to think, we know something can be helpful, and yet no one is able to get this helpful, or very few people are able to get those services that they need. So I was fortunate to have a guest speaker in one of my graduate school seminars from the Department of Mental Health and Addiction Services in Connecticut, and followed up there to get a graduate assistantship working for the Commissioner of Department of Mental Health and Addiction in their research division. So we were doing services research, evaluation of programs, so that the state of Connecticut could decide where to put its resources and how to make sure those services were available. And so I had this really great experience of getting to do clinical work, but also getting to see, how do you make sure these services really get out there? How do you do that really important work of securing the funding and the leadership support to make sure those services get disseminated? So for my internship, I really wanted to work in early intervention for serious mental illness, had an influential clinical experience that made me look into, what could happen if you intervene very early in the course of disorders like schizophrenia. So I ended up at the Yale Department of Psychiatry, where we operate out of the Connecticut Mental Health Center. And we developed one of the first programs in the US for early intervention for schizophrenia, specialized treatment, early in psychosis, or STEP. So we completed the first clinical trial in the US, but it was a pragmatic clinical trial, meaning we wanted to make sure that this was an intervention that could be delivered in any kind of community mental health center, not just ones that might have access to an academic institution or a lot of highly credentialed individuals. So we worked with the mental health workers in the center. And that was just such a great experience. But then I got homesick, and so I wanted to come back to Maine, and started up some programs in Maine, also in early intervention for serious mental illness. And then I ended up getting recruited back to join the faculty at Yale as the clinical director for the early psychosis programs there, and ended up still being able to do a mix of research, clinical work, administration, and policy work as well. So we did some really great programs around shortening the duration of untreated psychosis through public health campaign, as well as continuous quality improvement to give people rapid access to services. But then I got homesick again and came back to Maine, where, shocking to me, I was appointed to be the director of the Office of Behavioral Health under Governor Mills, where that role really allowed me to set public policy for mental health, make decisions about where funding would be targeted, what kinds of programs and services we would fund, working with the legislature to change state statute when needed, as well as secure appropriate funding. So that was just an amazing experience to be able to have that kind of impact in my home state. And now I'm very fortunate to have a similar role, but supporting people who have a director or commissioner of mental health title in all the states around the country. And so still pretty focused on early intervention for serious mental illness, as well as crisis services. And I just, lots of little side detours that I'm just not going to have the time to mention, but those would be the highlights and how I kind of ended up where I got.
Thanks so much. 17 years. Wow, that's a long time. A lot of people don't realize the time it takes from beginning to, really kind of getting things into the public service sectors. And so it's really, really important work that you've been doing and have done. So thank you. Dr. Lynn.
Thank you so much. I'm also enjoying the trip down memory lane. I would say the lesson of my journey is for people to really be open to pivoting when you realize that there's another opportunity you hadn't considered, or when you realize that your skills might be suited to something different. And also a lesson in welcoming just dumb luck and serendipity when it happens. So I was not a psychology concentrator in college. I did not have psychology on my radar. I had envisioned a career working on law and public policy for children and families. And I watched my friends go to law school, and they were so unhappy with the process. I thought, I don't think that's for me. I don't think that kind of training is really what I want to pursue. So I took some time off between college and graduate school to decide what I wanted to do. And a friend of mine suggested that I meet a former professor of his, a psychologist who was doing a research study and needed a research assistant. She was studying the effect of cocaine exposure during development on toddlers, looking at whether or not there were learning or developmental delays. And she needed help with her assessments. And I met her, I joined her project. I really enjoyed the work. And she mentored me through the process of filtering through my options. And I landed on clinical psychology, working with children and families as my career goal. I began my training at the University of Michigan in Ann Arbor, started to do my work with kids and families, and realized that I am not enough of a kid at heart to do really good play therapy. I just was not the person to do that work as well as some of my classmates could. And I looked for another option, and I found working with juvenile offenders in Detroit was an interest of mine. I started to do assessments for the court system there, and really enjoyed meeting these kids and learning about their lives and trying to find out how the court system could help them. But then I did those assessments and I turned in my reports, and I didn't know what happened to the kids. And I felt really unresolved about that. So I thought, well, I could be a provider inside of correctional systems. And that's what I did. I had already finished my internship in child and family work. I actually withdrew from school for a year and took a second internship at a psychiatric prison in Michigan. And I just thrived there. I really enjoyed the work. I saw the full range of clinical issues and was able to follow a case from beginning to end, which was really rewarding for me. So as I was thinking about what to do with this experience, literally one day I was on the campus bus and ran into a friend who I hadn't seen in a while. He asked what I was doing, and I told him I was looking for a job. And I explained that I was interested in corrections. And he said, "Did you see that flyer about a postdoc at a prison in West Virginia. It was hanging in his clinic and I hadn't seen it. He copied it for me, put it in my mailbox. We had actual physical mailboxes back then. And it was an internship with the Federal Bureau of Prisons. I'm sorry, it was a postdoc with the Bureau of Prisons in Alderson, West Virginia. And that's where I began my bureau career as a clinician. I went through a variety of clinical roles, moved up the ladder pretty quickly, experienced quite a bit of burden and burnout doing that clinical work in very intense environments for the first half of my career. So as I was carrying very heavy clinical loads, I realized that I was also really interested in how prisons ran. You know, how do you keep the heat on? How do you feed this many people 3 times a day? How do you make sure you're providing healthcare? And how do you keep it secure? And I had wardens who really thought outside of the box for me and didn't limit me to clinical projects or clinical roles and gave me assignments outside of the typical psychologist duties. And I transitioned into management over time and really enjoyed it, but was exposed to a lot of the organizational stressors and dynamics that big bureaucratic organizations face, and started to educate myself about systems, organizations, leadership development, team development, and all of those things that I'm working on now. And as I learned those things in correctional settings, I did my best to apply it and train others in those methods as well. There was a period of time when I was working in our central office in DC, guiding policy, developing psychology treatment programs, training our staff to deliver the programs and making sure that they were very high quality, and also working with the Department of Justice, the White House, congressional committees and commissions to really try to improve the conditions of confinement for people in our prisons and jails. But then I really missed being in the field. I missed working with staff and inmates, and I asked to go back out. And my timing was such that I landed in my first warden role just as COVID was descending. And we were trying to figure out what this flu was, right? And then everything I knew about how to manage a crisis, how to help people to manage extreme stress, and how to really apply what we know about resilience and self-care came in really handy as the leader of an institution. So I've been able to do a lot of different things, and again, it was just being open to opportunities as they came up.
I love your point about transition and serendipity. I think so many of us in this field relate to this, kind of pinballing around a little bit until you find what really, speaks to you and what really becomes a passion area for you. I know for myself, I started out thinking I wanted to do, be in law enforcement or be in the FBI, and kind of that transitioned into my current interests. And I also have a flyer story in my own pathway. If I came across this flyer that explained an area that I didn't know existed, and changing majors and not quite, figuring out where you want to land. So I really appreciate that transparency there. So thank you. All right, Dr. Tucker.
Sure. Well, I can relate to both of you quite well. I told everybody when I came to college I wanted to be a police officer, and that eventually I wanted to go work in the FBI. That was my intention. I come from a family of healthcare workers and emergency responders, and that's what I wanted to do. I then experienced that quintessential a door closes. I was denied a practical application for the FBI. I went through the whole process of applying and interviewing and the lie detector test, and I didn't make the cut. I was coming up near the end of my undergrad, which was at Loyola College in Baltimore, Maryland. Of course, they're a university now, but it was a college when I was there. And at that time, things are different now, but at that time, getting into the field of law enforcement was competitive. And I probably, for an agency as a woman with a bachelor's degree, would have done all right, but I wanted to push myself a little bit more. So I very last minute applied to a bunch of graduate schools for psychology because I thought, well, psychology would be a good major if I want to get into law enforcement in this field. I did horrible on my GREs, which GREs are an assessment that you had to take. I understand now that that's not always the case in graduate schools, but you had to then. But luckily, Nova Southeastern University in Florida, they really took into consideration who you are as a person, what you wanted to do with your degree. And I appreciate that. And I there met one of my very first mentors, Dr. Vincent Van Hasselt, who is a police officer and a psychologist. And that's when I really started to become open and aware that there are other avenues that I could pursue to do the work that I was passionate about. And one of the many pieces of advice that he gave me that I kept true to was, if you want to be a good specialty psychologist, you got to start by being a darn good generalist. So I took his advice and I did my internship and my postdoc all in community mental health. And I can't say enough about community mental health centers. I would be biased to say that I think every psychologist should start their career in community mental health for lots of different reasons. But I was really grateful for that experience. And I got to work with all the systems that I was interested in. I worked in jails, I worked in corrections, I worked for police agencies, I worked in inpatient psychiatric and outpatient, community, juvenile justice. Every opportunity that I was so interested in, I got to do in community mental health, because community mental health centers are truly the backbone and the safety net for the underserved in our country. So it was really fantastic to have so many different options afforded to me in that way. And then I would say that Dr. Lynn, I can relate to that. In my last position, I was a chief clinical officer at a community mental health center. And as COVID descended, and really took everything that I thought that I knew and flipped it upside down. And it was such an exciting challenge. And when things started to settle a little bit, I thought, it's got to be now or never. So I left that position and went out onto my own, and really had to reflect on what was it that I was passionate about. And probably one of the things that I loved most is training and educating. So I am faculty, but I also spend most of my time training law enforcement, corrections, fire and rescue, emergency services. So I got to really take what I love the most and make it the front forward of my career right now. So yeah, thank you for the question. That was a fun memory lane experience.
Thank you. You made it much further than I did in the FBI process, but it was an idea floating around in my mind. I think after there was an FBI agent who came to my high school class that I was taking, and he was just so raw and cool. And I was like, I just really want to do that. And then, yeah, so things evolve over time for sure. So thank you. I think this next question, I hope, will be a fun one for our panelists to answer. So our third question is, what has been your proudest achievement in your work as a public service psychologist so far? So back to you, Dr. Villarreal.
Thanks, Ashley. It was a tough question, to tell you the truth, just because I'm not used to tooting my own horn in that way. But I think first I wanted to just say that I think being in public service and being in a leadership role, I do think that it's never usually about my achievement, right? Because a lot of this work is done based on the people that support the work, especially in the teams and the healthcare system that we support. I think whenever you get into mental health and you also support suicide prevention, it really does take a village to do this work. But I've been very fortunate to have fantastic mentors and colleagues along the way. So I think before I kind of highlight some of the things that I really have benefited from in my career, I just wanted to say that I wouldn't be here today where I am in my career if it wasn't for their support. Believe it or not, I'm still pretty early career. I don't know what the time bracket is anymore in terms of when you transition to mid-career, but I'm gonna, still kind of own my early career status. I think this year marks my 10th year in public service, and all of that has been in the federal system. So I'm really proud of that. I'm really proud of being able to support our communities and our veterans specifically I think I've been very fortunate to achieve a lot of great things throughout the early part of my career. My alumni, Texas A&M University, honored me with giving me the Early Career Alumni Award for the university, which was really a great achievement. And really, I think still having so much ahead to look forward to. One of my greatest achievement in public service so far has been to be given the honor to lead our suicide prevention programming as the national clinical director for, again, the largest healthcare system in the nation. I can't tell you enough how humbling it is every day to step into this role and to support the work, and to really support, such a great mission like suicide prevention for our veterans and across our communities. I think one of the things, just kind of reflecting on everything that everybody has been talking about, I've been really just amazed about all the roles and all of the impact and the achievement that I think some of our panelists have accomplished. And I think you're just kind of hearing about the potential that our careers have to offer. But I think if folks are listening and you are an undergrad still trying to figure out what to do, you'll get there. Don't stress out. I think, one of the things that you'll find is that, many of us came into these positions and accomplished the things through trial and error. I think one of the things I've learned from our panelists is don't be afraid to take risk and to really kind of stretch yourself. So I say that because, I think when we think about achievement, we're kind of thinking about these huge accolades, but honestly, for myself, the greatest achievement that you can accomplish is just finding what you love and what energizes you and brings you to the work. And sometimes you're lucky enough to build a career around it. And I think I've been lucky enough to be able to build a career around something that I love. So I think that's where I'll leave it at and hand it over to our panelists.
That's a great answer. Thank you. Dr. Pollard.
Yeah, I also think this is a tough question. I think being in public service, we are always engaged in work that has impact on people's lives in really meaningful ways. And so it's kind of hard to pick, what you would feel the most proud of. But I would say, similarly, having led the Office of Behavioral Health during the time frame I did, which was just before the COVID-19 pandemic started, as well as in the midst of an opioid epidemic. And so really being able to make it through and make progress despite those enormous challenges, and leading a team of people, since of course none of this work was done alone, to really just try to keep everything running within the state system. So there were major pivots that we had to perform. Everything from changing policy to allow for people to still be able to access their methadone, to how do you quickly change rules and settings to keep people safe from catching COVID-19 and deliver services, make sure services were still available despite at times stay-at-home orders. So, and despite all of that, and just trying to maintain safety and access to services, we also managed to make progress. So we opened, for example, the first 2 methadone clinics that have been open in our state in over a decade. There hadn't been any new opioid treatment programs or methadone clinics that had opened in many years, and we opened 2 during that time, as well as the state's first crisis receiving center, which is a what I think at the time wasn't quite 24/7, but the goals of those centers are really low barrier. Law enforcement can drop off, people can come in, there's no referral barrier, anyone can be seen, triaged, assessed, and provided services, with a strong emphasis on peer support, or people who have experienced themselves with mental health or substance use challenges staffing the space. And it's a very warm and welcoming environment, as opposed to what you would feel like if you were kind of sitting in an emergency room or a jail in the middle of a mental health or substance use crisis. So we opened that during the pandemic, despite workforce challenges, despite all the other work that we had to do. So those accomplishments, I think, would have felt good anyway, but having them happen with everything else going on, just so many policy things that needed attention, so much that we were already rebuilding in terms of the state behavioral health system even before the pandemic hit. So I think I'm really proud to have worked with the people I did and to make the legislative funding policy service delivery changes that we made in order to keep people safe and give them access to services at the same time.
I would say that's a pretty big accomplishment considering all of
this gray hair. I mean, the lighting kind of hides it.
It sounds like it was worth it to get those services to people in need. So thanks so much. Dr. Lynn.
I also agree with Dr. Pollard that it's hard to identify achievements when so much of our work involves teams who really deserve the credit for the outcomes. But I would say that among my proudest achievements are steps that we were able to take to really improve the conditions of confinement for people in our prisons and jails. And some of that work was around reducing the use of restrictive housing or segregated housing. Some of that work was around increasing access to reentry programs to better prepare people to return to society. And some of that was around introducing more and more varied evidence-based programs to really meet people's needs, especially around trauma. So the clinical work and the access to more and better clinical services was a really important milestone for me. But top of mind really is having the privilege of leading during the pandemic as a warden. It is the hardest thing I will ever do. And it's also the most rewarding to have made it through and do my best to model resilience and empathy and self-care and crisis management and problem solving and doing all the things that psychologists are well trained to do when there may not be a playbook for exactly what needs to be done, but our training and our experience means that we can figure it out and tolerate the ambiguities along the way. And leadership during COVID was that for me. I would also say that one of my roles right now is on the board of directors of the American Psychological Association. And I'm very proud to represent public service psychologists on the board and applied psychologists, because I think we exist within one person very, very comfortably. And I would like for public service psychologists and applied psychologists to see themselves in APA perhaps more than they do now. So the more attention we can bring to the various type of work that we are doing, the better. Mm-hmm.
Thank you for that. COVID was certainly a challenging time for so many people, and for you all to be serving in leadership roles during this time is definitely something to be proud of. All right, Dr. Tucker.
Sure. Just a lot of commonalities in these panelists. So to build off of that, I think for me, one of the things that I'm most proud of is sort of two different experiences that have had the opportunity to coexist at the same time in my life. I very much believe in the values of to leave the world a better place. And when I became a parent, then it was about, well, I'm going to leave my family for this many hours a week. It's going to be even more so to leave the world a better place. So with that, I think that on one level that I never expected is some public policy work. And it sounds like many of us can appreciate that feeling. And I don't think I even knew what public policy work was when I got into it, but the way I describe it to strangers is actually working in other systems outside of healthcare to help redefine and sharpen or change rules and laws that either promote or are barriers to people becoming healthy. And two that I'm really proud of is one, working with many individuals in the state of Colorado, but including the Colorado Behavioral Healthcare Council and the Colorado Commission on Criminal and Juvenile Justice. We outlawed the use of jails as holding facilities for individuals who were involuntarily committed due to their mental illness. I think I was actually shocked when I realized this was a rule and it had not yet been outlawed, and so was really proud to just be a part of that. And at that time, I was working in a jail. I was both an administrator over a healthcare system, and I was regularly picking up shifts and providing the direct clinical work. So to sit with individuals for many times was their very worst time in their lives, people demonstrating suicidality, psychosis, certainly the issues related to drug use as well. To be a part of people's journey, that step forward, it's a humbling experience that I can't explain. And I'm sure many of us on the call can appreciate that when you develop a rapport with an individual who's at a really harrowing time in their life and wants to make that better, you realize you're a part of something greater than you can explain. And on the flip side, another public policy that I was excited to be a part of, Dr. Pollard, we should chat, but I got to be a part of Colorado developing their statewide crisis system. And I actually myself and my team opened up a crisis system, included a walk-in center, a stabilization unit, detox. And I remember the opening day, because it was written into our legislation, having a visitor from our governor. It was really exciting. But I equally remember at that time having a community-based visit with a client that I had kept. I always kept seeing clients in all of my administrative roles. And even to this day, I keep a small private practice. It keeps me very grounded in the heart of the work. But at that time, I remember working with an individual who had been in and out of jails and hospitals and inpatient facilities, and all primarily due to his behavioral health, mental illness. And I was really excited to tell them about this new crisis opportunity, that you didn't have to wait till things got really bad. You wouldn't have to wait that month to see the psychiatrist. You wouldn't have to call the police and hope that they sent somebody who was trained, that you could just seek the help when you needed it 24 hours a day. And honestly, I remember the look on their face, and it was one of those moments where I thought, this is it. This is when public policy makes the difference in the life of an individual and saves lives. So I'm hopeful that I have other achievements in the rest of my career, but I'm excited to be at a place where I can speak to those as well. Thank you.
Thanks so much. I think as public service psychologists, we have a lot of humility, but it's also really important to take a moment to recognize the real impact that we as a subfield of psychology, and you all as individuals on this panel, are making to our community. So that's great examples of the important work that we do. Okay, and then on to our final question. Some of you touched on this a little bit in other answers, but I'm wondering what you would say is the biggest benefit of being a public service psychologist.
Yeah, I think one of our panelists said it's never boring. I can truly tell you, every day it's an adventure. You're stepping into new opportunities, new partnerships, new relationships. You just, saw Dr. Tucker already kind of putting a plug in for Dr. Pollard in terms of how can we develop a network to really enhance our impact. So I think for me, it's the quality of training, the opportunity, the networks, the support, the career development, and I think that the flexibility to kind of stretch ourselves as we continue to apply psychology outside, not just mental health, but you can already tell from everything that folks have already mentioned that our work really extends outside of just mental health delivery. I think the nature of the work and the agencies that sometimes we get to be a part of allow us to really kind of operate from a place where we can really impact our communities in a different way. I think Dr. Tucker mentioned, be a part of something greater. And I think that being in public service psychology really has tapped in, at least for me, in that value. So I think really one of the biggest benefits is being a part of something great. I think I have the benefit of being a part of a agency in a healthcare system that has afforded me the opportunity to support a really good mission, and also to be a part of a great network of providers to do that. I don't think many people know that the VA trains and employs some of the, really the most psychologists in public service than any other agency. I think right now we're roughly at about over 6,000 psychologists that we employ. And it's really an honor to be able to tap into that network and have that network of colleagues to be able to share that expertise with. So I think the possibilities, the resources, and the opportunities are something that I've really been able to benefit as a psychologist in public service.
Thank you, Dr. Pollard.
Well, I'm happy that you already mentioned the public service loan forgiveness, because I would say financially that's a pretty big benefit. I can say as a beneficiary of that program myself. But in terms of other benefit, I think the satisfaction of seeing the impact of your work, as well as really being able to engage that problem solving skill and connecting the dots, I find that just incredibly rewarding and satisfying, in being able to see how you've helped both at a macro level and seeing the statistics or the policy and how you've moved things at a community or system level, as well as the individual stories and the ways that people's lives have been impacted kind of on the ground. And so thinking about, for example, a policy that we implemented, or several policies we implemented to make sure that the life-saving drug naloxone was widely available, looking at the statistic of how many overdoses turned out to not be fatal. Of course, we still lose way too many people to fatal overdoses. And it's important to look at how many lives have been saved from the distribution of naloxone. So that's kind of a macro level. And then thinking about an individual in my own life and family who struggled with opiate use disorder, and how he benefited from the programs and services that me and my team and others made sure were available, and to see how that really has changed his life, as well as our family and his support system, and the relief that we have, having seen him now 3 years free from opiate use. And so it's that both sides of things, the macro level and the individual level, that you get to have that sense of meaningful impact. And it's very hard to describe how rewarding that is.
Thank you. Dr. Lin.
I second those comments, especially around public service psychology being very mission driven. And also that you're able to address really complex problems at both the individual and the system level. So what I would add is that a lot of public service settings are multidisciplinary, which means that as a psychologist, you're working alongside people with other types of expertise and experience. And I found over my career that I had a lot of opportunities to really demonstrate the value that psychology brings to these settings alongside colleagues in other disciplines. And sometimes that meant dispelling stereotypes or misunderstandings about psychologists and what we do. But it also was just on the ground day to day, being able to show that attention to mental health and substance abuse issues in correctional settings made our institutions safer and kept staff safe and able to go home every night, right? And made it so that people could return to their communities better than when they came in. So the opportunity to show the value of psychology in these multidisciplinary settings is a big benefit of our work.
Thank you. All right, Dr. Tucker, if you could wrap us up here.
Sure. I echo everything we heard. What a intelligent, thoughtful, and passionate panel we have here today. I feel really humbled to be a part of it for sure. I think the one thing I would add that hasn't already been stated is flexibility and opportunity, especially if any of you are resonating with some of the themes you heard here today of I'm not 100% sure, I think I want to do this, I might want to do this. This specific area of public service psychology can really try on a lot of hats. You're afforded a lot of unique opportunities, and you can switch around, and there's nothing wrong with that. In fact, people expect that. So I would say that flexibility and opportunity, just to build on what's been stated, are great benefits of being a public service psychologist.
Thank you so much. And I definitely echo your comments that this is just a great panel. And I really enjoyed hearing your stories and experiences and all of your accomplishments. So thanks so much to our panelists and to the Office of Applied Psychology for helping showcase the diverse and important work of public service psychologists. We hope that you'll consider joining us as you think more about your career path in psychology. With that, I'll turn it back over to Dr. Schwartz.
Yes, thank you all. What a wonderful group of panelists. You've provided some incredible examples of how the field of psychology and public service really impacts so many individuals and so many communities in important ways. And I just wanted to let everyone know you can view all of our applied career videos online at apa.org, or you can learn the many ways that psychological scientists apply their knowledge in many different settings. Thank you so much.